Yeah. Our guest not yet joined, right?
You can start, Bu. Bu Devi, you can start now.
Okay, our guest, our speaker already joined with us. Okay, okay, thank you very much, President Ayla and all president from Africa for joining in our video conference. And hopefully in this moment we can got little bit knowledge about technology. Every week we listen about the new technology from our partners. This is maybe like a wasting time, but if we uh, positive thinking and want to know about knowledge about technology, this is very nice. Yeah. For me also, Ayla also to join with the technology conference. We have new knowledge about the technology. This is the important for us, and hopefully not only we got new knowledge, but we can collaborate for the future. Yeah. Thank you very much, President Ayla, and for our speakers. Time for you. Can you explain about your technology, and hopefully we got a lot of knowledge about your technology. Thank you very much. Ayla. Hello. Miss Ayla.
Mr. Lesego was here. Hello, Mr. Lesego.
Yeah. Our speakers already joined or not yet, Mr. Miss?
He was here. He was here. Maybe you can explain a little bit about what is the purpose of technology leading change. What is your program? The purpose? Until until we wait for the speaker to. I think he got cut off.
Yeah, he got cut off. He says that he's trying to join in again.
Okay. In the technology, we have one purpose. We can explain about the new technology, and we can make collaboration each others, and hopefully we can found the new opportunity for us to make a collaboration, and not only for business, but we can help each others. Yeah. And we can make we can build the networking a lot of country, and develop technology together. Not yet join yet, our speakers. Miss Nadia.
He was here before, but maybe
who is another speaker?
No, only both of them. So maybe you can share a little bit about your company also, Beb.
Okay, okay. I will wait a moment, yeah. Oh. Dokumen. Oh, cannot.
Our speaker is back. He's back on.
Back?
I'm back. Hello.
Okay.
Can everybody hear me?
Okay, okay. Yes, you can.
Can you see me? Can you hear me?
You can start your presentation.
Okay. I'd like to start by greeting everybody.
Yeah, thank you.
Sorry, I just had a bit of a problem here with the electricity cable and everything. Now there we are. I'm back on now. My name is Lesego Mpshe from South Africa, and I am the founder of MediRez, non-emergency transport services. I'd like to start off by saying that my background as an entrepreneur, which I've been most of my years, I started out in small startup businesses in South Africa, from property management business and auto body shop business and other food chain businesses. And at the moment, I'm currently in the transport and tourism industry. So when I started the transport tourism industry, that's when I realized that I was actually getting calls from people that actually needed rides to hospital. And when the pandemic came in, I actually got more WhatsApp messages and more phone calls of people asking me to transport their parents or their children or family members to hospital because of the emergency services were actually very scarce. Then the concept actually started from there. So I actually decided that I must actually sit down and come up with an app which will actually be able to help me and everybody else in the medical industry. So how the app actually works, hopefully I'll be able to check it down here on the, there we go, this one is not there. How the app works is that if a parent is actually a member of MediRez, or they've registered maybe with their insurance company, medical aid companies, they'll be able to download our app. And I would like to give it in an example way. You find that you have a child that is at school. Can everybody see that on their screen as well? Sorry. Hello?
Yes, yes.
Can you see the MediRez, how it works on your screen? Is it showing?
No, it's not showing.
It's not showing there. We were actually working, it's showing on my screen here. I'll try another way as I speak. But if, for example, a child would be in needing medical attention at school, the teachers will call the parent and will inform them of what happened to the child. For example, the child was running on the school grounds and they fell and they sprung their ankle. Then the parent will have to leave whatever they're doing, work, meetings, or whatever they're engaging in at that particular time, and would have to rush through traffic and everything else to attend to the school call and take their child to the doctor to get examined. So if they have a medical app, which is the MediRez, they'll be able to contact a MediRez agent in that area, something like an Uber. So the medical agent will be retired nurses or unemployed nurses who will be licensed and will be having a vehicle, and they'll be able to get to the school with the parents' consent as the MediRez client and assess the condition of the child at the school. Where they see that no, the child's injuries are actually minor and the child will be able to attend classes. They'll actually attend to the child, bandage the child, and contact the parent to say, no, they will not need further medical attention. And then the child will obviously come back and pick up the child from school when they are done at work. But in a position where the medical nurse gets to the school and finds out that the child will need further medical attention, then they will request the parent that they will be taking the child using the vehicle that they came in as a MediTrans vehicle and take the child to the nearest hospital, or with the consent of the parent will actually inform them that the child can visit their family doctor, which is in the neighboring community. So now the parent has got a peace of mind, and then they can also be efficient at work. And where we found that with our elderly parents, what happens is that the child, my mother, for example, she stays alone and she's diabetic. And she's also got medical visits that she does monthly. Most of the time, I'm the one that is taking her to those medical visits. So I have to cut and fit her in throughout my schedules of the week. So if she is one of the medical app users, she'll be able to actually order a ride like an Uber, but this time it's with a professional nurse who will be able to take my mother to the appointments that she needs to go to. And then if my mother, for example, she stays alone and she becomes ill in the middle of the night or throughout the day, she can simply contact me or go to the app and a click of a button, and the MediRez nurse who is the nearest to her residence will be able to come and assist her, just like an Uber. But now this time, a qualified nurse will be coming to attend to my mother's condition. And they're going to inform me as third party that, look, Les, we found that your mother needs to go to a hospital with immediate effect. So she'll be able, the main concept is that we are first response, because we realize that an ambulance will take something 45 minutes to an hour. So with MediRez, it actually cuts down on the time. Through the MediRez app, which works, like I said, like the Uber, where we'll be having nurses in that area that when the SOS calls goes out, the nearest nurse will probably be something like 3 kilometers or 4 kilometers away, and they'll be able to attend to that patient immediately. So I'm gonna try and ask my assistant quickly to try and get me back on my slideshow here, and maybe he'll get it right for me. I think it's when we had the electricity cut out now that it scrambled everything immediately. So I'm just going to allow him to just do that, and please forgive me for that as he's trying to get us on track. But for now, I can just try and just fill up more without the presentation. So how the concept, actually the app works is this. We will actually be hiring retired nurses. This is now the employment part of it. It's going to employ retired nurses or nurses that have qualified and just come out of their training colleges. And the nurses will be able to have a vehicle. The vehicle will be supplied by MediRez, or they'll have their own private vehicle if they have, which we will assess according to our standard, if it's fit enough for operating in the medical healthcare system. Where now the nurse is now sitting with a vehicle and an app. The minute our nurse is online, they'll be able to receive emergency SMSs through the app, and they'll be able to respond to the nearest patient in their area. Unlike an ambulance that will probably leave from 30 kilometers away or more. So in a position where we have rural areas in South Africa and most of the places around the world, where transport is very scarce, especially for the kids and the elderly. You find where kids are playing in a river or a dam in the rural areas, and a kid drowns there. Now, once the child gets rescued, they will have to wait for a paramedic through an ambulance to come there. But with MediRez, even if it's a village of 5,000 people, there'll be one or two people that are part of. Can we see it now? Sorry. Can you see anything on your screen?
Yes.
Yes, we can.
There we go. Yes. So sorry about that. This is the simple steps of how it works. So, but in any case, where the child is now in an emergency situation, and you find that they, in every village or every city or suburb, there has to be a neighbor who is a nurse somewhere around. But now by empowering this neighbor with the app and the MediRez vehicle, they will be able to attend to the child within 3 to 5 minutes and possibly save the life of the child before the ambulance can arrive there. So in a position where our vehicles will not be able to take the patient, it's a severe emergency or critical situation, they'll be able to stabilize the child or the parent or the user till the ambulance comes to the scene. So on the step here, if you can see step one, this is an example of a student. Step one will show you that the teacher will log into the app and fill in the personal information and give it to our agent. So when the agent comes, already knows the situation, the age of the child, and they can also send them videos of the injury or pictures through the app. And step two, the nearest MediRez agent to the patient will be dispatched and perform their duties as a healthcare practitioner, as a nurse. Then the parent will be able to track the vehicle to the school, and also from the school, if it's taking the child to the nearest healthcare hospital or doctor of their choice. So which will actually make it much easier for the parent to know exactly where the kid is and how long it's going to take the kid from the school to the nurse through our GPS tracking. So I'm also skip to the other one. So you can actually the whole presentation. Let me try and get to that one. This one there. There you go. It's open me. So with the MediRez app, it's something that's actually just going to simplify the way the medical transport services and non-emergency transport services attend to people through the app. So here is our company logo, MediRez, non-emergency medical transport mobile app. Is everybody on the same page as me?
Yes, Ken.
Hello.
Yes.
Thank you. Let me go to this one. So it will actually be providing a very, very important healthcare service to the communities, and also giving the nurses that we have at the moment, which are unemployed, an opportunity to get back and do what they were trained to do through the MediApp app. So as we're reading the crisis, is that what I realized was that during the current COVID pandemic, movement and help, where you can now, before you could ask a neighbor if you had a child that was sick, or you had one of your family members that was sick, to help you with their transport to the nearest doctor or hospital. But now, since everybody is scared of the COVID-19, people cannot offer services to help each other as friends and family or neighbors. So I'm quickly just going to go through this one for you, and where we realize that in a situation where we have people with life-threatening diseases, chronic diseases, where people are attending chemotherapy, they're going for radiation, which is a weekly thing, or kidney dialysis, or HIV and AIDS treatment, where they are the ones that actually felt it the most, because they had no choice, but they had to receive that medical attention. But transport was the biggest factor that we realized. Hence, I got a lot of phone calls, people asking for my shuttle service to actually become a MediRide, where I'm transporting their family members to and from hospital and checkups, where I had a friend of mine who was working 300 kilometers away, and he couldn't come back home. But he knew that I'm there and I'm able to assist if there is a medical emergency, because he's got a son who is asthmatic. So I had to attend to that son and take them to the doctor as soon as possible. So let's see here. Sorry about that. So what I'll do, I'll actually be able to send this to anybody who needs more information on the MediRez. I'll send the full company profile and presentation. I'll email it through, then we can actually you can go through it at your own spare time, word by word. But due to limited time, I'll just skip through everything. I'm sorry. So this one is on the chronic patients, who are really the patients that need this. Kids, chronic patients, and the elderly. And now we find a situation where my wife is at work and she's working 100 kilometers away from home, and she finds herself unwell at work, and she is a MediRez client. She'll be able to then, on her app, contact the nearest MediRez agent to come to her office and assess her at the office without her endangering her life further by driving on the public roads in her condition. So the nearest MediRez agent will be able to go to my wife's assistance and assess her at work. And if they feel that she's in a position that she cannot drive home, they'll actually take her to a doctor's. After the doctor's appointment, they'll be able to drive her back home with an extra MediRez nurse driving her car behind. That's where the peace of mind comes in. Sorry, let me just skip up. Where people now, we find that people are missing their primary care appointments, And that's a very, very big impact on the medical industry, where people cannot come to appointments because of transport. And another important one is waiting. People are tired of waiting for ambulances and response time on that. So people will be able to set up their appointment and check the vehicle of the MediRez and know that it will be there in less than 3 minutes by tracking it on their mobile app. And another one is the costs. MediRez will be much lower than ambulance response, because we don't come with a fully equipped ambulance. We don't come with costs that are implicated when an ambulance is called out due to the size of our vehicle. There we go. So the mobile app on itself is actually the whole vehicle that will put everybody on the same page. Everybody is our patient, the nurse, and the hospitals and doctors. Where doctors, if a child is in a medical emergency from school, a doctor will be able to know that within the next 10 minutes, I'll be receiving a patient who is going to need this and that and that, which all that information will be fed to the doctor through our medical app, and they can make room and bed for that child to be attended to at that hour, at that immediate time of arrival. Let's go down. Okay. So another one is unemployment. We've got a very high rate of women unemployment in our country, and we've got qualified women as nurses, and they have driver's licenses, they have cars, but they are not employed. So if they become part of the MediRez chain, it will be like what Uber did in the taxi industry. You find people with vehicles, but now their vehicle is used as an Uber taxi. So the nurses will be able to use the MediRez, the vehicle as a MediRez, and be on standby and work whenever they want to. They just have to be online, and the minute they get online, they'll be able to get any distress calls sent to their messages. And the solutions is it makes it easier where now people don't have to call an ambulance or any other way, but just use their mobile app. And they'll get real-time tracking of the ambulance to know how far or how near is the nearest ambulance and how long will it take to get to you. It's going to be very punctual because of the real-time tracking, where now the patient will be able to get immediate response, not going through a call center or any other towers that will have to first contact the emergency services, give them the address. The minute you punch the key, the SOS key in your phone, it's going to send your location where you are, and then our nurses will only be waiting for you to describe it. Where the client is in a position where they are not able to type or describe the injury, that's where the video comes in. They're able to send a video like on WhatsApp. It's on the panic button. They'll be able to send the video, and then they'll be able to send a picture, just like WhatsApp, where the nurse will actually be able to assess before they even get to the patient, to know what they're dealing with, so that by the time they get there, they already know what to deal with. We're looking at about 3 to 10 minutes response time compared to your normal ambulances. Where I found in a case, a family member of mine called me and they were in an accident about 6 kilometers away from my house. And I drove, this was about 2 weeks ago, where I drove out and had to wait with her. The ambulance only came after 60 minutes. An hour later, that's when the first response ambulance was there. But that's where I realized if MediRez was there, I made it to her 6 kilometers away. I was there in less than 4 minutes. I was there. So imagine if she was on a MediRez, she was a MediRez member. She would have received first response medical attention within the first 2 to 3 minutes. And then cost cutting, we cut on the quality. Quality is going to be number one. We need to improve the standard of medical efficiency and quality. Cost cutting. And we're also going to be cutting down on unnecessary hospital visits. Somebody is not feeling well, but they do not need to see a doctor or a visit or a hospital, but they do need medical attention from a professional, which the front line is the nurses. So they'll be able to receive that from the nurses without even visiting a doctor or a hospital, unless our qualified nurses says differently. That's when they'll be able to say, okay, I think in this condition, you need to see a doctor. And then the other one is a subtle approach compared to an ambulance. You find people where you are in a situation of a non-medical emergency, and you do not want the red light flashing around at your house, and your neighbors are wondering what's going on with you, and this, you just need simple medical transportation. So this is where the subtle approach comes in, compared to a normal ambulance. Let's see here. This is the advantages of MediRez. Child health care, first of all, is one of the first advantages. And transportation. People have got a problem of transportation. We're going to improve the health industry by a whole lot, because people, like I said, there won't be influxes in the hospitals. People will be able to get diagnosed from home, and the healthcare worker will determine if the patient should be seeing a doctor, or they can attend the patient at home. And it will also give entrepreneur will be able to get a certain percentage from every call out that they have attended to through our MediRez offices, and employment opportunities for our nurses that are unemployed or that want to venture from employment to entrepreneurship, and for retired nurses and so on. Higher standard of quality health care. That's our aim. Our call out response will be based on the route traffic. This is the one that will actually help us to respond as quickly as possible. For example, if somebody is based in, let's just say, in a town called Acacia. In a town called Acacia, it's a community of, let's say, 100,000 households. We know 100,000 households is going to need a minimum of 100 vehicles to service them. So our members that live in that community will be able to service that community, because even if they're at home and they get SOS call out, they'll be able to be familiar with the routes, familiar with the area besides the GPS. And I believe that they are the ones that will be there within 3 minutes of the emergency. Unlike an ambulance could be anywhere around the country and will have to leave from point A to point B, can be 100 kilometers. So I think that is about it for now here. And yeah, what a MediRez nurse is going to need is just a smartphone, an app, a roadworthy car, a valid driver's license, and nursing qualification. And obviously we're gonna give them training from MediRez, how we approach our call out. Thank you very much. Like I said, for further questions and more information, through the little time that we have, I would be more than happy to actually send an email out of the full concept layout. And this is a picture of one of the vehicles, that how our vehicles will be kitted out. So it's a simple vehicle where we'll be using station wagons or we'll be using sedans. A sedan vehicle will be the one that will mainly be for non-emergencies, where it's a call out or it's a doctor's visit where they don't need a stretcher bed. So on this one, it's a vehicle that is built like it's a station wagon, and we'll be converting our vehicles to have a single bed in it and room in next to the bed for a third-party member if they need to travel with their patient to the hospital. So that's just a simple rough picture of how the vehicle will look like. And yeah, this is my information, my numbers and email. For those of you who are needing further information on MediRez. Let me get back to the screen here quickly. And out of the presentation. And I think I can take our time. And I'd like to thank you very much for everybody that was participating in this. Thank you.
Okay, thank you very much.
Thank you. Were you able to see all the pages that I showed?
I saw. Thank you very much. Very interesting your presentation. Actually, we also have in Indonesia like a track virus for COVID-19. Maybe we can discuss about for development program, yeah, for development apps. I give suggestion. Maybe the apps not only for virus, but can also provide the medical things to the people, like a sell people want for medical, like that. In your apps already have like as a medical shop.
That's on the full presentation that actually, unfortunately, at the moment, I couldn't present it all. But we'll be able to deliver, like I said, on the HIV AIDS patients, will be able to deliver their medication or chronic these patients will be able to deliver their medication through the app. Will be able to book doctor's appointments on time, scheduled, and the app will be able to notify our clients that don't forget tomorrow morning at 8 o'clock, you've got a pickup time.
Yeah. Because I also make a collaboration with hospital in Indonesia. We have a track virus system and connect with PCR for swab tests for COVID-19. So everybody can test, swab, and go to the hospital and got the certification. And the important things is big data. We can know about track virus, COVID-19 special, yeah. But we also have services to sell medical product from our apps. In Indonesia, our system name is track virus. You can search in the internet. Track virus. This is our system, and we already implement with the hospital in Indonesia. We also sell the PCR because they provide the PCR and make a consignment system with the government and consignment system with the hospital. So we provide the machines. Hospital no need to invest and buy the machine, and be a consignment system, profit sharing like that. We this is just sharing what we do in Indonesia. Yeah, maybe can for your opportunity for development your apps for the future.
Yes. Yes.
Beb, do you think we can bring the apps to Indonesia, these apps, with collaboration?
Hi, Ayla. Yes, the whole concept here is still a startup. So I need collaboration where we can develop the app further, where we can actually collaborate and bring it to Indonesia. You see, so that one is actually the main reason actually why I'm actually proposing at the moment, which is collaboration.
Yeah.
Are
And
you
also,
able to hear me?
Yes, I can hear you. Also, I will introduce you also with few people. Yes, like DevI also have the access to fund. But I have a partner also in Singapore that does traditional medicine. So this maybe you can also have put in there as a option. Like.
Can you just repeat that?
Can you hear me?
Can you just repeat that? It was breaking very bad.
Can you hear me now?
Yeah, much better.
Okay. I don't know if we have wellness every Monday. I think yesterday we have wellness. So we can maybe collaborate with Abby as well to create another section of herbal medicine to deliver to the house. You see, the problem now, nobody wants to go to hospital. Nobody. I take out my mom to hospital. Nobody really. But this is a very good system, and I think in Africa it should be very new. If you have 1.3 billion population, then you need about, if you say over 10,000, then you need about 1,300,000 people to work on this system. So that can help people around the world, yes? Hello?
Yeah. Ayla,
Our network is.
can I ask something? Are you already implement with hospital in Africa or with your government your system?
Very bad. Sorry about our network and anything.
Hello.
Now you are back. It was if you have a population of 1.3 million people, then it stops.
Question for you: are you already implement your apps collaboration with your government or with the hospital in your country?
At the moment, that was the steps that I was initially taking, but because of the lockdown and everything else, our governments have not been working in their offices. Everybody's been working from home, so it was quite difficult to actually collaborate or present it to anybody at this present time.
Yeah.
That was the biggest hiccup.
I already make a collaboration with four hospitals in Jakarta, and make collaboration with provide a PCR swab test with connected with apps track virus. Maybe if your country need the PCR, we can collaborate. We can send the PCR to your country with the consignment system, but must have good people in the hospital, yeah. And now about the technique and IT system.
Yes, that's the most important.
And
So,
I also have a school, yes, school. This school
yes,
is
Ayla?
internationally, this school is international. So I tell you also, if you have the people who can train, they can be certificate internationally also, as long as you are collaborating with a medical school back there in Africa. So I think we can help many women that doesn't have a job right now to teach them, and then bring them to your system. That's what I'm trying to do with real estate, but I think it can be duplicated in different how you call it, different industry.
True, that's true.
Yeah, and then you have DevI, you add the value with the what, with this PCR, but you still need the people, right? So you need to train to able to control the whole Africa, 1.3 million people.
True.
But they also need to have vehicle.
Maybe you can
They
find
need to have.
you can find my name in a Google, Erna Rachmawati, with NDS, PT NDS. We make a collaboration with hospital, make a MOU. But this is need the people in the Minister of Health or association medical and doctor.
Okay, Devi.
Yeah.
Yeah, maybe can I say something? I have invited one of my friends. She's working at the National Department of Health. She can just give us clarity, maybe on her personal experience, not being representing the department per se, just to give us clarity on how the department is doing when it comes to those kind of collaborations, or how you can work with the department. I have invited my friend, is Mujaji. Mujaji, can you just give us light and share with us how in the national department things are, maybe how do you do, or how can you advise Lesego to do? Yeah.
Yes. Good afternoon. Good afternoon. I'm not representing the department. Yes, it's just that. Can you hear me? Hello?
Yes, we can hear you.
Yeah.
Oh, yes. Yes. Hi, good afternoon. I did talk to Lesego and try to advise as much as I can. In terms of the department, I think what I said to him is that, like, I think I've had one question to say, have you presented this to the government or to the department? And I said to him, the first thing that he must do, he must start small. he must go to the province and present this initiative that he wants to do and see how they embrace it. And I think it will be good because it will be sort of a pilot before it's going to be maybe engaged in other, like with the whole country. So it's better to start small. If he's in Gauteng, go and present it to the Gauteng Department of Health and see how they can take it. But I think it's a very good initiative which can help and assist a lot of people. And I said to him that realizing that COVID is here to stay, I think that's one thing that he must include in his proposal. Make sure that that app is also going to assist the government, because whatever that you are doing as individuals, as NGOs, you should try to assist the government in whatever that they're trying to do. So that's a good initiative, but what you can do, go and knock in the doors of the provincial people, make sure that you make it work, so that when you come to national, you said, no, I've started in this province and it has worked, and it will be easier for other provinces also to follow suit, to say, no, this has worked in this province, and you can take it from there.
Thanks. Okay.
Thank you, Mujaji.
Thanks. Thank you so much.
Yeah,
So
I think
what I will do, I will introduce Lesego also to Abby, Datin Sri Paduka Abby, because I know she wants to have an application. But she is not medical. Yes, she is more to herbal medication. But I think it's worth it to try. I will introduce you, set up a meeting with her, because she wants it to have an application. Now you already have the application. We just have to sit down how to make the collaboration, right? Like maybe we can even bring this to Singapore. Because she already in Singapore. She already very big in Singapore. I'm trying to bring her medic thing to Indonesia. And maybe we can collaborate with her, edit your apps.
But
That sounds like a good idea.
if we want to bring something, we must try and trial and error, because the system from Africa not yet applicated with the government or with the medical, because IT is not so easy. Yeah, must applicate it first, and when we already have samples. So we can application to another country.
Is this system already work in Gauteng? Is this already work in Gauteng? Is this already working in Gauteng?
No, it's not working. As I said, it's a concept that I actually, everything that stopped this was the COVID-19 pandemic.
COVID should not stop you. COVID
No,
should
I
not
continue.
stop. Yes.
Yes.
COVID
I
should
continued
not
with
stop
everything.
business.
Unfortunately. Yes,
Yeah,
ma'am.
but I tell you what, first of all, I set up a meeting with Abby, number one, and she wants to have an app. Since it's the apps is ready. Is it already downloaded? We can download it.
Ayla, this
No, I'm still talking to her.
concept, Ayla. So maybe we in Indonesia we already have application and already start, and we can download in application. Your idea in Indonesia already start. So if we build from zero,
Yes.
it need a time 6 until 1 year, I think. Better, I give suggestion for Africa, use the application already developed and ready to use. So no wasting time, and can work quickly. Because your idea in Indonesia already have application like that.
Can you hear me?
President Ayla, can we maybe propose that maybe for now, myself and President Debbie will assist Lesego to maybe engage with one of our government department to start with this app, and then from there,
This is
that's when
amazing
we will-
concept, and I can smell
Yeah.
money.
I
I'm
know
a very
that
good smeller with money.
Yeah.
my
Already.
husband, yes, my husband told me I'm a money speller. You know, I can smell money. You know, and I think we can be successful helping Lesego, helping also people to get jobs. You know, that's the most important thing. And I can support with my school. Have the international certificates. That's what I can support, and introduce you to Abby. Abby maybe can add value in terms of not only medical, like chemical, but more to herbal. So yeah, this is money. I think your idea can work with a lot of collaboration from people.
Ayla,
Yeah.
in Indonesia, I already start the application and collaboration with the hospital. You can short the application is track virus and Hai Sehat. This is two application and already launching. Maybe we can collaboration with others to overseas. Yeah.
But it's
Yeah,
a very
I
good
think
idea.
There we go.
very good initiative. And I think with the ambulance services, because we know that in some other areas, they hijack these ambulances and they cannot have a track of it. And I think that we'll take it to the Gauteng Department of Health. We'll try to talk to Ntate Malotani and see what will he say about the whole concept, because he is the one who is responsible for the ambulance services. And at the national level, it was Muchaji. What is that lady who's responsible for ambulances?
I told Lesego that it's akere all out it's now
Pakiso.
Pakiso is still there, yes. Mara Ola
Okay, I'll
Salatoko
speak to
like Peter
Pakiso.
Furi. So I think he must
No, I'll
talk to
speak.
Anna and Pakiso. Yeah, Pakiso DDG,
Yeah,
or the chief director.
Yeah, I'll speak to Pakiso. I'll speak to Anban Pillay, because he is the one who is responsible for ICT for health. Yes, thank you.
And like I said,
Thank you.
I started small. Start small, even though low, because usually at national, when they ask you, they'll say, did it work now? You must try small. Go to Gauteng, talk to EMS services in Gauteng, and make it for they like the concept. Then from there, when you come to national, you say, no, I've started it, rather than coming to national, because they'll say, have you started it? What is it that you have done? Was it embraced and all that? So Gauteng, I think, is the best province to start with. Yeah,
Noted.
And then we'll also
find
go
out
to
now,
Northern Cape, because even to Northern Cape, because Northern Cape, they use ambulances for lifts, and then it can be so that it can be traceable. Okay. And Northern Cape, we will go to Northern Cape and even in Gauteng. Thank you very much. Thank you. I think we are going to have a meeting in few minutes.
Thank you very much.
Bye.
Thank you. Thank you very much to everybody that participated and asked questions and gave me all the advice that I've had so far. What I wanted to find out is to Mujaji. My main point now is that I need collaboration with already established companies in the medical transport industry or in the medical industry, because, like I said, I need to actually develop the app. So before I can go and approach any government institution in South Africa, as Mayor Mujaji said, they're going to need something that's tangible. So at the moment, I've been working with, it's only now that the guys
Devi already have the apps. You can collaborate with her. Why so far away? She has already the apps. You can collaborate with her, bring it to government.
Yeah. We have
No problem.
Yes.
So
Yes.
who's got the apps?
She got the apps.
We have Hai Sehat and we have Track Virus for coronavirus and connect with the PCR. So everybody can test, swab test and got a certificate. And the important thing is a database. We can now the location who somebody COVID-19, who somebody have a case of COVID-19. This is we do it when and already applicated with the hospital.
Oh, great. The problem is that when we were communicating earlier on, you were breaking a lot. So I missed a couple of things that you said, but now I understand what you say. Noted. I hear that. Any more questions for me before we close?
Yeah, I think as part of way forward, Debbie, maybe what I propose, maybe you can have a meeting after maybe that session, yourself, let's say President Ayla and President Debbie, so that you can plan for the way forward on the collaboration. But also on our side, we will do our program for Gauteng province and Northern Cape. That's my proposal.
Please, I really appreciate that.
We need the data from your country. How many PCR need in your country, and the current situation. How many PCR you have? PCR is for swab test.
How many apps do you have?
How many PCR in your country, in a hospital, and the government still needed PCR for swab test.
Someone's network is off here.
Yeah, hello. The connection not good, yeah. Hello. Hello, the connection not good, yeah.
He will answer you offline. Maybe we can go for close, yeah. For the close.
Okay, maybe next week my director will present about track virus and PCR, yeah. Ayla, if you give us a permission, we can presentation about the track virus, medical apps, and the PCR next week.
Yes. Go ahead, my dear.
Okay. Okay. Maybe our partner already out and trouble with the video conference, I think. Okay, maybe we can finish our video conference. Madam Ayla, you can closing statement. You can give closing statement and praying for us, and hopefully God save us from COVID, yeah, because this year's the important things is health. Okay, Madam Ayla, please closing statement. Hello. Hello.
Dave, I think
Hello.
most people, they are cut off today. Dr.
Okay.
Ayla? Yeah.
Ayla, can you give a closing statement? The connection. Yeah. Can you give closing statement, Beb? Madam Ayla.
No, I call President Rebecca to give closing statement because that is her friend, and also praying by President Debbie maybe or President Lesego.
Okay.
Okay. Thank you very much, President Ayla. Thank you very much, Dave, for the wonderful program. And I just want to thank also Lesego for the presentation of a good app, MediRez. I just want also to thank all the guests who have logged in today. And then we are praying and wishing that this collaboration must go far. We see a good opportunity, especially for job creation amongst our women, especially our professional nurses who are currently at home. And we know that the WWLC, this is one of the programs that will pride ourselves with and will make it to work for our organization to grow in Africa. I thank you very much. And I saw President Dolphin. President Dolphin, I'd like to acknowledge you for today's presentation, and I will make sure that all
Thank
our
you.
Africa
Thank you very
presidents
much.
understand that. Yeah, I thank you.
Thank you very much, President.
Okay.
Rebecca.
Pleasure.
See you next
Yeah.
week.
Thanks.
And next week, we will present about the track virus and opportunity make a collaboration for PCR, provide a PCR in your country. I will invite my director to present. Yeah. Okay. Thank you very much for all. And
Thank
see
you for the good
Yeah.
presentation.
Yes.
Thank you very much.
Thank you for the
See
good
you next week.
presentation. Bye-bye. Thank
Bye-bye.
you. Bye-bye.
Yeah, bye-bye.
We are the woman leading change, leading change. We are the woman leading change, leading change. We are the woman leading change, leading change. We are the woman leading change for our people,
Yeah.
for our countries, for everyone in the world. Love, peace, needed in this world. Endurance, needed in this world. Forgiveness, needed in this world. Unity, needed in this world. Yes, African woman leading change. Antarctican woman leading change. Yes, Asia woman leading change. Yes, Australia woman leading change. Yes, Europe woman leading change. Yes, North America. Yes, South America, woman leading change. Galerato fella, Galerato fella, woman leading change. Galitabo fella, Galitabo fella, woman leading change. Gotando pella, Gotando pella, woman leading change. Yes, Indonesia. Yes, Ayla. Yes, Ayla. Woman leading change. Yes, Indonesia.
thank you, world woman leading change.
Okay,
Wow,
Thank you.
nice.
Everyone.
Thank you. That was so nice. I lost connection.
And
Bye.
inspiration opportunity in the medical apps. Yeah.
Okay, thank you. Thank you
Thank you
very
very
much.
much.
Bye-bye.
Bye-bye.
Debbie,
Bye-bye.
Thank you
Debbie,
for
can
a
I
good
ask something?
presentation.